Just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. And we've already got some questions from our viewers and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas-Fort Worth area in Texas. And guess what? He's even writing a book that's coming out next year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome everyone, and now let's welcome Dr. V and start our show.
All right, let's do that.
Let's go.
Hi everyone, I'm Dr. Kumar Vadivel, but you can call me Dr. V. I'm so excited to be here with you all today. And let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm especially trained in taking care of gums and bones and that support your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology and the American Board of Periodontology. That's a fancy way of saying I work with a bunch of dentists who are experts in gum health. I started ToothHQ Dental Specialists, and we have 4 offices, as you guys know, in the Dallas-Fort Worth area. We are all about making sure that your teeth and gums stay healthy and strong. Now I'm here for you. I would love to hear any questions you may have about your teeth and gums, and you can ask questions live here right now or even send them for our next show. Your questions help us really make these shows helpful, not just for you but for everyone. And one more thing, if you like what you're learning here, please let us know. Your feedback is super important to us, and don't forget to like or subscribe to our channel, and so you don't miss out for any latest and greatest updates and any helpful tips for your dental health. I'm looking forward to talking with you all and answering any questions, and let's make our smiles the best they can be, right? Let's get started.
Let's do it. All right, so we're going to kick the show off with our first question. I have 30 teeth without any wisdom teeth. Is this possible?
Absolutely. So what you're asking is whether you only have 30 teeth. Normally you have 32 teeth, but instead you have 30 teeth, and it is absolutely possible. Sometimes the wisdom teeth do not come through into the mouth, which means like they never came into your mouth. So when wisdom teeth are one of the most common things that you normally see missing from your mouth, and it is very possible you never got the wisdom teeth. From the sound of it, like you only have 2 wisdom teeth. So get it checked out with your dentist, and maybe sometime it is not possible for you to see the 2 teeth, and they may be buried under the gum line. So when you go to the dentist, they take an x-ray, what we call it as a panoramic x-ray, to be able to see whether you got 30 or 32. And if you only got 30, you got 30, and the 2 never came in. Okay?
Got it. So it's possible to never grow them in.
Absolutely, and wisdom teeth are one of the most common ones. You never grow them in. Yeah.
All right, you heard it here first. Why does a bone graft cost more than a wisdom tooth extraction, considering it seems to involve just a small amount of material that may not fully enter the extraction site?
So the one of the most common things that you see, right? It's not uncommon for somebody to ask the question, why do the bone graft cost, considering it seems like only to involve like a very small amount of bone. So just a quick story, right? Like when just because you are seeing, like let's say you got to have some kind of something to be fixed in your home, and just because it is just going to cost you like $5 or $10, and that is not the same thing that your handyman or a plumber or like whoever is going to fix your home is going to charge you. There is always going to be some installation fee, and then there is always going to be like another charge for their professionalism and all of that. And then in our case, we are in the medical world. We deal with whatever that whenever we are dealing with the biological material, the material cost is going to be even higher. And then, expertise. I went to school for 13 years to become a specialist in my case. So we do go through like a lot of professional schooling, which takes like a lot of time. So you're not just paying for you're not paying for just the material. You're paying for, in our world we say, hey, it is not a matter of doing it, how to do it right, and where to do it, and when to do it, and how can we do it right, the proper way. That's what you're paying for. In other words, you're just paying for the professionalism and the expertise that we have, not just for the materials.
So you pay for what you get.
Yeah, you do.
Pay for what you get.
Absolutely, yeah.
Perfect. Alrighty, on to our next question. I'm 58 years old, diabetic, and have 3 wisdom teeth extracted. My 4th wisdom tooth has an erupted because a nerve runs through it, and the oral surgeon advised against removing it. What are my options?
So you got a total of 4 wisdom teeth, and of the four, three have come through. One is under the gum line, and more than likely the oral surgeon advised not removing it for considering 2 things. Mostly one, not because you're a diabetic. Of course, I understand that you have diabetes. As long as you have a controlled diabetes, we can treat you for the most part like as good as any other normal patient. Considering your age, more than likely the oral surgeon advised not to remove it because our cutoff, like we say usually like is about a 35 years old. So anytime you are over kind of a 35-year-old, meaning like if you are going to have like any type of risk or complication associated with wisdom tooth, the chances are of your risk going higher is very likely when you're over and above the 35 years old. So that is one of the possible reasons. And also sometimes you could be younger, but the nerve is sitting very close to the tooth, and it is very possible the oral surgeon is considering all the factors, the tooth sitting close to the nerve, and you're older, all of those reasons. And as long as there is no real reason for you to be removing that, it doesn't mean that you always have to have all wisdom teeth removed. There are many reasons. We just say, hey, you don't have to worry about wisdom teeth. They are not causing any problem. Just leave them alone. So it's kind of like I always joke with my patient, don't wake up a sleeping dog, so you don't have to. So you don't have to ask for trouble.
Now, what if it hurts?
If it does hurt, like it is a different story, right? And so that's a great question. So if it does hurt, let's say it is still lying close to the nerve, and you got to have that removed. So you don't have a choice. And it's kind of like, what I normally say in this patient, and to those patients, I explain to them, hey, you are hurting, and I understand that you're like a high risk patient. Then we explain all the risk, and the chances are like even though you may be a high risk patient, it doesn't necessarily mean that you're going to have any type of complication. It's just that we got to inform you, or maybe we inform every single patient. We have to better inform you or go into the complications a little bit more in detail, so you make a totally informed risk of what your risk and benefits are.
What are some of the risks?
Some of the risk, and just like she mentioned, the nerve damage, right? That's exactly what she's mentioned about, talking about the oral surgeon mentioned. So what is nerve damage to? To answer your question is, when you have a nerve or the wisdom tooth sitting closer to the nerve, you are going to have some kind of a damage to the nerve, which you will be feeling as there is some kind of an altered sensation or numbness to the chin or the lip following the procedure.
Perfect. It looks like we got a live user giving us a question.
Okay.
All right. So, here from Michigan, I'm someone who loves having their real teeth. Does active Crohn's disease? Does active Crohn's disease with gastrus and GERD have an effect on gingival health? I have a beautiful smile, but I have recession on my lower teeth. By the way, I have no bone loss, just my gums receding. And I saw my file on the computer, and Crohn's disease and GERD was typed in red. That's why I'm curious.
So anytime you have any type of these GERD or like any type of like a gastrointestinal disease, you're going to throw in like very possible like a lot of acid into your mouth. When you bring in like a lot of acid into your mouth, and that is going to definitely damage your teeth because acid is not good, which is just like any acid you would think, right? It is just going to erode the surface away. The acid from the stomach, when it comes into your mouth, that is going to erode your tooth away. So when the GERD or the acid when the GERD produces the acid in your mouth, it is not only going to damage your teeth or maybe going to erode your teeth, also because of the acidic nature, it is going to also cause some irritation to your gum. And it is very possible that you probably had some sensitive gum to start with, and then on the top of that you have this acid attacking your teeth and the gums, and then it is very possible that's the reason why you're noticing the gum recession on your teeth. And it's not the end of the world, just FYI. So sometimes the receding happens because you have a thin gum tissue, as I said, to start with, which is kind of like your GERD acting against you and your the thin gums acting against you. Now what you can do is you can see a periodontist like us, and whichever part of the country you are in, and the periodontist will be able to diagnose what kind of a gum receding you have, and possible that they are able to make your gum tissue thicker. So now, although you may have GERD, now your gum tissue is able to resist the wear and tear. So then you end up keeping your teeth for possibly even the rest of your life.
Awesome. All the way from Michigan. Check
Thank
us
you
out.
very
We're
much.
going global.
Thank you, Michigan.
Absolutely. Well, that was a great one. We'll jump back into live questions in just a moment, so definitely keep sending them. But a viewer did send in. I watched a video about dental implant procedures, and it looked quite intimidating. Can you tell me if the procedure is painful?
It's not uncommon for people like like you watch YouTube and you watch TikTok and you will see all of those crazy things, right? And people say that, oh, is that painful? Because it's literally it looks like a screw that you can put in the mouth, and I don't know whether you guys can see it well enough, and that's what it looks like. It is like a screw that goes inside the bone. So when you watch this, it's almost like you're putting in a screw in a wood, and that's what it is going to look like. And people are going to think that it is going to hurt. Guess what? Anything that we do in the mouth, and we are going to give you a lot of numbing, and we are going to make you completely numb. So even when you are going to get this procedure done just with the local anesthetic, just numbing, you should not feel anything. And by the way, I do all these procedures all day, every day, just with the local anesthetic. But if you're anxious, and then if you have some anxiety or a dental anxiety, or if you're fearful about this procedure, you can very easily be put to sleep. You know what we do? IV sedation.
That's right.
IV sedation, we put patients to sleep. So we can put patients to sleep. So if you are concerned, so you can talk to your surgeon or your dentist, and they can either give you some extra numbing or they can put you to sleep. To answer your question, does the dental implant hurt? It does not hurt during the procedure, and it is not like as painful as you might think. My recommendation is, move forward and talk to your dentist and ask them about what you need to know, whether it is painful or not. Then they should be able to answer that for you.
That's right, and we do it on site.
And there we go. So if you happen to be in the Dallas-Fort Worth area, come see us.
Come see us.
Yeah.
Okay, perfect. Alrighty. So next question, Dr. V. After a root canal treatment or root canal retreatment that involves drilling through a dental crown, how long does the crown typically last?
So looks like you already had a crown, and then now you needed to get a root canal. Now you're asking, now they have to drill through the crown into to get to the root canal. So whether you are going to have a root canal done through the crown, or you are just going to have a crown, the crown is going to last like as long as the crown is going to last, which typically, like sometimes we say like it anywhere between 5 to 10 years or 15 to 30 years. I've seen crowns last like 5 to 10 years, or they last like even up to about 30 years. It depends on how good you take care of it, right? So, I give this example to my patients. Sometimes, people take very good care of their car, and they keep riding the same car for 100,000, even 200,000 miles. So the same car for 10, 20 years, because they took really good care of them, right? The same way. The teeth need like a lot of maintenance, and I call It's a lot of TLC, a lot of tender loving support. If you brush them, if you floss them, and you get your gum cleaning done, you get your deep cleaning done every couple of years, and then you go see the dentist without fail, like every 3 to 6 months. So if you do all of those things and your home care and the professional care, and can the crown last for like 15, 30 years? Of course. And I got some crowns, all pre-dental school damage, by the way. And I got some crowns, those are more than 30 years old. I still have them. They last very long. They've been lasting for very long. So you can have that too, as long as you take good care of them.
Absolutely. Perfect. So taking a look here, we're going to get back into a live question. You ready?
Mm-hmm.
All right. So, hi, Dr. V. One of my cheeks is noticeably fatter than the other. When I pinch the skin on my cheeks, the right side feels thicker. However, there's no pain, pus, discharge, or loose teeth. Should I be worried?
Just because you see some things like in on your teeth, that doesn't mean like you have to be worried. Sometimes you see some white plaque, and sometimes you see some discharge, and so it may not be like necessarily some kind of a discharge. Sometimes this is not uncommon. Sometimes patients use some kind of a mouthwash, or like particularly the mouthwashes that carry the alcohol. It sometimes feels like the gum tissue is kind of peeling away. So just because you're noticing something, you don't need to be worried. Of course, if you have like it is coming out, like it has a pus discharge coming out, and you are experiencing a lot of pain, you don't need to be concerned. But at the same time, I'm not going to say you don't have to worry about it. You can ignore it. My recommendation is anything out of the ordinary that you are going to see in your mouth or anywhere in the part of the body, just go see a dentist or the doctor, and they should be able to take care of that for you. That's what I would recommend. Yeah, as simple as going to see the dentist.
Perfect. Super good question. Definitely keep sending them in, and we'll keep jumping in the comments, seeing what's going on, you guys.
You can come closer, I think, a little bit. Yeah.
All right. Okay. Hi, Dr. V. I received implants and dentures a while back, and they were comfortable initially. However, I've recently started feeling some discomfort. Can full denture implants be adjusted if they don't fit properly?
So one of the main reasons why the dentures don't feel comfortable, don't fit well over a period of time, it happens over a period of time. It doesn't happen just like that, because your gum starts to erode away, your bone starts to erode away, and the material of the denture starts to erode away. So combination of things, and then the aging process, right? So a lot of things kind of happen overall, like and then they all happen together, and they all kind of happen concurrently, and that is one of the reasons why the dentures don't fit well over a period of time. To answer your question, can they be relined? Can they be adjusted? Absolutely. So they can be relined, they can be rebased, and then they can be adjusted, or you can even have like sometime a new denture made. However, those are not like the long-term fixes, because you cannot stop the bone erosion just by making a new denture. You cannot stop your aging process. You cannot stop the gum erosion just by making a new denture. So the answer to that would be, consider getting some implants. Talk to your talk to your dentist, and whether you need to consider, particularly if you are in the process of remaking the denture or relining or rebasing the denture, whether implants are going to be a better option for you, because you can prolong, or you can increase the longevity of the denture, and you can also prevent the bone erosion and gum erosion by considering some implants. And they could be as simple as getting some implants to get some snap-on teeth, or it could be like a full set of complete fixed teeth.
Alrighty, absolutely. Well, great explanation. And it looks like our Michigan follower really appreciates your answer. Giselle Hart did say, thank you so much. I really appreciate you answering my question. I love your videos. What you said made complete sense.
Okay, thank you very much. Yeah,
absolutely.
Perfect, yeah.
So shout out to you.
Thank you, Michigan,
Giselle.
again. Yeah.
All right. So you guys definitely keep posting your questions in the comments. We would definitely love the opportunity for Dr. V to be able to answer those. Alrighty. Hi, Dr. V. I can't afford implant treatment, and I'm missing 4 teeth. Do you offer an all-inclusive package that covers consultations, post-surgery follow-ups, and other related services, or are those charged separately? Oh, may I do the honors?
Yeah.
Oh, okay. This is a question for me.
Yeah.
All right. Absolutely.
Because this is what you do every day.
This is what I do every day.
Right. Okay. All right.
That's right.
Mhm.
Okay, so definitely when you come visit any of our 4 locations in the DFW area, all consultations and imageries are free. So we'll take a free x-ray for you so that we're able to see what you have going on orally, and your consultation is at no charge. When it does come to our services, we have great deals and discounts for you that we can offer to assist you, including payment plans. So definitely come in, get a treatment plan with one of our great providers, and our treatment coordinators like myself will definitely take the opportunity to do what we can to make it affordable for you within a reasonable amount of time. Any post-op care that you need to ensure that everything is healthy and properly placed and still looking good will do for you as well at no charge. And when it comes to any further services you may need or to add on, we'll definitely do what we can to make sure it's affordable for you.
Perfect. So can you also cover, like, whenever we do the implant, we give them a package price to implant, and then the abutment that goes on the top of that, and then the crown. Can you yeah.
Absolutely. So we're able to do everything in-house. We'll give you a full cost for everything that's packaged together, and then from there we still have different ways that we can help you pay for those treatments so you can get started on your implant journey immediately.
Perfect. So sounds like you are you're possibly following us, and then sounds like or looks like you are in the Dallas-Fort Worth area. We got 4 convenient locations. Come see us in one of the locations. You may end up seeing this lovely face, whichever location that you are going to be, and you may be this may be the young man that you may be coming across too, if you happen to be in our Carrollton location. So come see us, and we can definitely take good care of you.
That's
awesome.
Right. This young man just lost a year, right?
Man, yes.
All right. Absolutely.
Did you say handsome young man?
I did.
You did. Thank you.
That's right. You heard well. That's right. Absolutely. Come and see us so we can definitely help you out. Hi, Dr. V. When I floss my teeth daily, my gums bleed for almost 5 minutes. What can be the reason? Should I see a dentist?
So I'm going to answer the second part. Should you see a dentist? Absolutely. So whether you have problems or not, like I would still recommend you do it like on a regular basis, and you need to see your dentist. To answer your first part of the questions, your gums bleed for 5 minutes after you floss them. Yeah, the gums bleeding for 5 minutes, it definitely not a good sign. Gums bleeding, even if they bleed just at the time as you go in, and it's okay. Yeah, because that's the way. Like I actually tell my patient, hey, I want your gums to bleed when you floss them, or sometime when you brush, and particularly when women, when they are pregnant or when they have their menstrual periods, and the gums tend to be sensitive. The other reasons that the gums tend to bleed will be because you have severe gum disease, or you have a lot of tartar, or you have a lot of plaque buildup, or you have a lot of bacterial activity. Those are the things that you do not want to ignore. So that is the reason why your gums may be bleeding more than usual, which is like the 5 minutes that you're describing. So you don't want to wait until it is too late that you have some severe gum disease. You are going to end up to the degree that you may end up even losing the teeth. So you don't want to ignore that. So go visit your dentist, and they should be able to help you to whatever the gum treatment that is going to you are going to require to help you keep your teeth for a long period of time.
Absolutely. And how often should you see your dentist?
You tell me.
Once every 6 months at minimum.
Every 6 months, and definitely once every 6 months, like Shai said. However, when you have gum disease, and more than likely we are going to recommend you see the dentist every 3 months. So, so between 3 to 6 months is the rule of thumb.
Absolutely. Perfect. All right, you guys. We're getting really close to our game, but we're going to do another question before we get there. Hi, sir. I started smoking cigarettes in college, and I've been trying to quit, but I just can't break the habit. To help, I tried chewing gum after smoking to avoid lighting up again for a while. However, a friend told me that chewing gum after smoking could increase the risk of mouth cancer. How true is this, sir?
Well, the chewing gum, so can you chew? So I'm just going to break this into multiple parts because it's a long question. So chewing gum and smoking, and then chewing gum, whether you can chew the gum after smoking, or what causes cancer, right? So the what causes cancer is the smoking, not the chewing gum. So period. If you're concerned about cancer, the first thing that I want you to do is to quit, right? And if you quit, then the chances of you getting cancer is very unlikely. However, if you are off and on, yeah, you are going to consider, or you are going to carry the same risk, although your risk may go lower. Going back to, can you chew gum, and chewing gum after the smoking, it is not going to increase or decrease the risk of your cancer from the smoking. It is going to stay the same. However, chewing gum after the smoking part, is that going to increase or better your oral health? Very possible, because what happens, and when you chew gums just period, not necessarily after smoking, you increase the salivary flow, which kind of flushes the bacteria. So now it is going to help with your mouth health. So the same effect is going to be there even after you smoke and then you chew. So to answer your question, yes, chewing gum after the smoking, it is going to increase the saliva flow and brush some of the bacterial activity. And apart from that, you still have the same risk of you getting cancer from the smoking, irrespective of whether you use the chewing gum or not. And you also run the risk of losing teeth as well, irrespective of whether you're going to use the chewing gum after or not.
All right. Absolutely. Would you say it's healthy to chew gum?
Sorry, say that again?
Is it healthy to chew gum?
It is healthy to chew gum to a degree. If you do overdo it, then you're going to get what we call it as TMJ, correct. Yeah, so you're going to get a lot of jaw joint problems because you overdo it. It's kind of like somebody running a marathon every single day. You're going to end up ruining your knees, as sooner than later, right? So that's the same thing. If you put your jaws to work and they are there to help you with the eating and drinking and the talking and the regular everyday function, but if you're going to overdo it by chewing all day, then you're going to end up causing a lot of wear and tear to your joint sooner than later, and they're going to start to tell you, hey, you got a problem there. Yeah.
That's right. And I'd like to add another positive of gum after smoking. It helps the breath.
Yes, yes, it
Thanks.
does. Yes, thank you for reminding me.
Thanks for being considerate.
Yeah.
Alrighty, so we have a game to play.
Oh, okay.
All right, are you ready?
I'm trying, man.
Okay. All right, rules of the game, rapid fire. 30 seconds or within 1 to 2 sentences, okay?
All right.
All right, here we go. Can a person's race influence the color of their gums?
Of course, yeah. So the race or the genetics is going to determine the color of the gums, and then the darker you are, more than likely the darker your gums are going to be. Pretty much, yeah.
All right, there we go. What should be done if a toothache persists for a week and then suddenly resolves itself on its own?
Still go see a dentist, because you don't want to ignore. Sometimes, you don't know what is cooking under the hood. So you definitely want to go see the dentist. And just because the pain went away, that doesn't mean that the problem went away. So it may be just temporary. So I still recommend you go see the dentist before you start to see serious damage to your tooth.
All right. What is the proper sequence for oral hygiene?
Either brushing, flossing, and seeing the dentist, or flossing, brushing, using the mouthwash, or combination of everything. And what I tell my patient is anything and everything that you can do at the minimal brushing and flossing.
All right. You're losing this one. I don't know. You're out of practice. Yeah. Is butter an acceptable substitute for oil and oil pulling?
Absolutely. So oil pulling, if you believe in it, going back to piggying back on the other question, in addition to the brushing and flossing, if you are doing some kind of an oil pulling to improve your health, oral health, yeah. Can you do butter? Yes, butter has some anti-inflammatory properties, and it can definitely help on the top of the brushing and flossing.
Well, isn't that a new meaning for butter teeth?
Well, yeah, it's just like applying like a butter, like a lotion
You
on
know
your
what butter
skin.
teeth are?
No. Like you mean like they are going to melt away?
No, like you have a lot of tartar, so they're yellow.
Okay. Okay. You are talking about that butter teeth.
Butter teeth.
Yes, yeah. Yeah, the butter teeth. You don't want to have butter teeth. If you have butter teeth, come see us.
That's
we
right.
can fix them, yes.
Alrighty. What's the deal with toothpaste tablets? Yay or nay?
A is the answer if you can't find the toothpaste. So something is better than nothing. So people, when they travel, they don't want to carry the toothpaste, and then they're looking for like a quick fix. And so instead, you carry the tablets. Although I don't see like a huge benefit, you are going to carry a bottle of tablets. Instead, carry a small toothpaste. Yeah, but toothpaste tablets, it is better than nothing. A is the answer.
All right, that must be a TikTok thing.
Yeah,
I haven't seen those.
absolutely. Yeah.
All right.
Amazon thing too.
Oh, okay.
Yeah.
I gotta get on Amazon a little more often.
Yeah.
All right. Well, let's jump back into the swing of it. I'm 7 months pregnant and want brighter, sparkling teeth for my baby shower. Is it safe to get my teeth whitened during my pregnancy, or should I avoid exposure to so many chemicals? Also, does laser teeth whitening involve the use of chemicals?
So you kind of pretty much answered your own question, right? Like, during pregnancy, we do not recommend you use any type of chemicals. And although you may be applying some whitening gel to your teeth, and those are going to get absorbed into your system, and anything that you are going to get absorbed into a system, a lot of these, chemicals, they have not been tested on pregnant patient. So my recommendation is either this hydrogen peroxide or carbamide, which is one of the other medication that we use for tooth whitening. Those are all the things that we do not recommend when you are pregnant. Sometimes people say like, oh, can I get Zoom whitening? Because they think that there are no chemicals involved in it. Even the Zoom whitening, which is a light, some kind of a light that we pass onto the teeth, even that involves some kind of a chemical application and passing some light through it. If you want to make yourself emotionally feel better, you can ask your dentist and maybe just do some Zoom whitening. Although you may not get the maximum effectiveness of it by applying chemical followed by the light, you can just do the Zoom whitening and then see whether that is going to make yourself feel better. Yeah.
Perfect. Absolutely. Okay, so wait if you can. Definitely. You should have your natural pregnancy glow anyways.
That's right.
We'll see it anyways, right? Alrighty. Hi, Dr. V. I've been experiencing gum issues for quite some time. Could you recommend any toothpaste or mouth rinse for prevention?
My recommendation is to get the basic fluoride, a basic fluoride toothpaste, and it doesn't matter what brand it is. And my recommendation is minimally at least get like a kind of a mouthwash. If you're able to, then preferably like any non-alcoholic mouthwash should help. So any fluoride toothpaste or any non-alcoholic mouthwash and should be the way to go. Brand doesn't really matter. Depending on whether you have some softer teeth and you may need to stay away from whitening toothpaste and all of that. Your dentist will be able to give you a better answer depending on the nature of your teeth. So talk to your dentist and they should be able to recommend.
That's right. Okay. Hi, I have a cracked tooth, but it doesn't hurt, so I'm assuming the nerve isn't damaged. Can implants be placed after removing the cracked tooth, or could a mini implant be used to support the cracked tooth?
So the nothing is going to fix a cracked tooth unless the crack is small enough, and then you are going to get a crown and the dentist is able to evaluate, and then whether you are going to need a crack, whether it is a mini crack, it does not go all the way down, and yeah, they are able to fix it just with the crown. It is very possible. But to answer your question whether an implant is going to fix the crack, a mini implant is not going to fix the crack. However, a mini implant can help you replace the tooth if you were to have the tooth removed. Although we do not recommend you get a mini implant to replace a single tooth, we recommend a regular sized implant for you to replace the tooth. If the crack is too far enough into the root, then now you're not able to salvage the tooth, and talk to your dentist and they should be able to remove the tooth. Now they are able to place the implant to restore the tooth. And if the crack is very, very minor, or it's a micro crack, then your dentist should be able to fix that just with a crown.
All right. And what's a mini implant?
Oh, mini implants are like if you could imagine if this is the thickness of the implant, for example, like this thick, and that's the regular thickness of the implant. Many implants are skinny, like a real skinny, maybe the 1/4 of these implants, and they are normally done mostly like when patients have they have a complete set of missing teeth. When they have complete set, they don't have space really when the bone has completely gone down, and this is the way that we normally place the implants, 4 implants. When the bone gets really thin, for example right here, as you might see here in this case right here, so the bone is supposed to be really thick after you extract them, but over a period of time, when they become like really thin like this, then you cannot place a regular sized implant. So you need to get mini implant. That's what those are.
Got it. Okay, there's something for everybody.
Absolutely.
Okay. Well, let's get back into our live questions. Hi, doctor. I'm Henry, 30 years old. I recently went for teeth whitening because 2 of my front teeth are yellowish. During the x-ray, my dentist mentioned that my front teeth have very short roots and they said eventually will fall out, requiring implants. However, the teeth aren't loose. I was told something similar 10 years ago. How long can teeth with very short roots usually last?
So, are the teeth going to fall out, and can we fix a timeline for that? You sound like you already proved wrong. You already proved the other dentist wrong because the other dentist told you 10 years and then you still have them. So we really can't fix a timeline, although your teeth are like completely, what we call it as a grade 3 mobility, right? For example, when the teeth are slightly loose that you cannot feel, I could feel it, I may call it as a grade 1. Sometimes it's a little bit beyond, you're starting to feel it, we call it as a grade 2. Or when you start to see the teeth kind of going back and forth, then you could pretty much say it is going to fall out anytime. That's what we are going to call it as a grade 3 mobility. To answer your question, how can I give you a timeline? No, we can't really give you a timeline. However, if you had a long discussion with the patient, let's say that's me, like you're going to have discuss with me, I'm going to ask a question back. Hey, are those teeth are they just solving your quality of life? Are they giving you a quality of life? Or are you always concerned, hey, eating something, biting onto something, when you are in a party, then when you are smiling, you're always thinking that those teeth are going to fall out. So if they are that loose to the degree that you are always thinking, and you don't want to ever lose your self-confidence, in that case, I would say probably they are not going to last for the rest of your life. And if you are going to replace them now, if you are going to replace them 5 years from now, why not replace it now? Then you can at least save that period of time. One thing that you can never buy is the time that you lose in your life. So I would highly recommend you consider the quality of life and then decide sooner than later to replace the teeth with a dental implant. That's what I would recommend.
Okay, can you stop teeth mobility?
You can, to a degree that you can do that, because a lot of times what happens is the teeth are mobile because one thing that we did not go in detail is whether you had braces. If you had braces, or if you had a fall during your childhood, and if you had some injury to the teeth, that may be the one that is causing this looseness and what we call it as the erosion of the tooth. Not the erosion of the tooth, what we mean, erosion of the root under that you see. You cannot see actually underneath the bone. We can actually see that on the x-ray because the roots are kind of really short. So if that happened because of the trauma or like some kind of a fall, or if it happened because of the braces, it is very likely that that is what you're feeling. And if the simpler fix sometime, what happens is because of the bite, the deep bite. So it is because of the deep bite and your bottom teeth are constantly hitting, and that's what is causing. That is an easy fix, and all we have to do is sometime grind or file the opposing tooth down so it's not kind of really pushing on the other tooth to help with that. Yeah.
Okay. If you have short roots, do you need a mini implant?
No, my recommendation would be to have a
normal implant.
regular implant. Yes,
All right. Well, you
yeah.
qualify for a regular implant. That's a plus. Alrighty. Hi, Dr. V. After my wisdom tooth removal, I unknowingly bit my tongue. Once the anesthesia wore off, the pain in my tongue became severe. I read the laser treatment might help with this. When can I get the laser treatment done, and how quickly will it relieve the pain?
So one of the greatest benefits that we see with the management, pain management. One of the greatest benefit we see is with the laser is the management of pain. So whether it is short-term pain or long-term pain, the what we call it as a photobiomodulation and the therapy, because of the biomodulation, laser is able to help with management of the pain. So even if you are experiencing some short-term pain after the wisdom teeth procedure or some kind of an ulcers that is happening, we can definitely help you with the laser. Whether you really need it, then you kind of be the judge, right? So if you are suffering to the degree that you really you want to get the treatment done, yeah, any laser dentist that you can find in the local area, of course, we would love to see you if you are in the Dallas-Fort Worth area. So talk to them about, absolutely, come see us, yeah. Talk to them about whether the laser is going to help you with the pain, not necessarily just the pain after the extraction or ulcer, any type of pain. Like sometimes we do the laser even for the TMJ pain, like the temporomandibular joint pain. So a lot of things, you can really benefit, a lot of benefits you can get from the laser treatment.
That's right, and we do laser here.
Absolutely. Multiple type of lasers. Yes. Yeah.
Yes, absolutely. Alrighty. Hi, Dr. V. I had measurements taken for a dental cap, but I missed my fitting appointment. My next appointment is scheduled for next month. Will the delay affect the fit, or is it okay to wait until then?
1 month, possibly not. But if you are going to keep waiting for multiple months, then my recommendation would be not to wait that long. So what happens is, like, after you take whenever you have missing teeth, the other teeth or the opposing tooth, they do not stay in place. See, adjacent teeth, they are going to start to move. The opposing tooth, they're just going to start to fall down. Or if it is a bottom tooth, if it is going to start to move up. That's one of the reasons why we recommend not having to wait. However, if this is a small cap that you are going to have put in on the tooth, more than likely your dentist already did a temporary crown for you. So I don't think there is a cause for concern unless the crown is not fitting properly, the temporary crown is not fitting properly, or you lost the temporary crown, you were traveling, and all of that stuff. So to answer your question, my recommendation, 1 month should not be okay. Even a couple of months should not be okay, as long as you have a temporary crown.
Perfect. So don't delay. Alrighty. So we'll jump back in for our final live question for tonight, but definitely take the opportunity to send in your questions. If we're not able to answer it on this live, you can be on the next one. Doc, can I mix salt with my toothpaste, or should I use them separately? For example, should I brush with toothpaste first and then use salt afterwards? Please advise.
So toothpaste is the way to go to brush your teeth. So if you are wanting to use salt, my recommendation is do not brush with the salt. If you guys, if you could imagine for a second, the salt is a little bit gritty, right? So whenever you're going to take the salt and when you're going to brush it, you're going to pretty much abrade. And so you're going to abrade or shave away the part of the tooth, and the tooth is going to erode away. So my recommendation is you brush with your toothpaste, and then do not put the salt on the toothbrush to brush, because you're going to make the tooth erode away. Instead, what I would recommend is after you brush your teeth, use a salt and then use a warm salt water to gargle your mouth and use it as a mouthwash. That is going to help instead. If you are going to do it a salt water mouthwash, and then on the top of that the regular over-the-counter mouthwash, and you're going to get all the benefits of it And do not forget to floss, because either the salt or any other type of mouthwash, it is not an alternative to flossing. So to answer your question, not just the brushing and the salt, and the brushing, the salt, and the floss. Okay?
That's right. Perfect trio. Okay. Hi, Dr. V. I delivered my baby a week ago and my baby already has a tooth. However, it looks slightly purple and seems a bit loose. Should I be concerned? It also makes feeding challenging. Please advise.
So so the babies are sometimes born with the teeth, right? So we call it born with the silver spoon, but people are born with born with the teeth, and we call them natal teeth, because they are born with the teeth. Of course, like when you start to see some kind of a purplish, and it is because it is possibly starting to push through the gum line, or the baby has a little bit of bruising around the gum line from the natal tooth, and that is very possible. There is nothing to be concerned, and of course, I can't say that without having to take a look, right? And of course, you're absolutely perfect, and it is going to make the feeding very challenging to do that. The only thing that I can think of is, like, very rarely we do this, and although of course, with the challenging on the feeding, you're going to kind of somehow figure it out, like the way the baby is going to latch, or you're going to, with the position, moving the position of the baby, you're going to somehow kind of figure it out, how you're going to feed your baby. If you're not able to figure it out, can you take the baby to the dentist, and the dentist can gently file it down just a little bit? It is very possible. We don't go to that extreme, because normally, like, the nature takes its own sweet course, and then most of the babies get better. But can you go to the extent of taking to the baby to the dentist to kind of file it down? It is very possible it can happen. But you're absolutely right. It can make the feeding challenging. But do you need to be concerned? If you don't have any type of feeding challenges, you don't have to be concerned. But always, just take an opinion from the dentist if you are able to do that. That's what my recommendation would be.
What happens with the tooth as the baby grows?
Say that again?
What happens to the tooth as the baby grows?
Oh, the tooth keeps growing. The tooth keeps growing, and could be either a baby tooth that is supposed to come at the 6 months mark. It came a little bit earlier, or it could be an extra tooth. Again, the baby needs attention on day one. The baby needs to go to the dentist on day one. That's what that special baby sounds like, or the high maintenance baby sounds like, right? So you are going to take the baby to the dentist anyway if you are going to check it out. So like Shai was asking, if it is a regular tooth, if it needs attention, talk to the dentist, or if it is an extra tooth. What I mean by that is, if a tooth that is supposed to come in at 6 months that came in early, then you can get it checked out. Or if it is an extra tooth in addition to the tooth that is going to come out later at the 6 months mark, that may need some attention also. So it is a matter of checking with the dentist to see whether any treatment needs to be done, or it's just a matter of just monitoring. It could be as simple as monitoring, but it's always, to have a pair of eyes look at it, which is your dentist.
That's right. Go see your dentist. Hi, doctor. I have a severely loose tooth. I've undergone splinting treatment. Can laser treatment help reduce the looseness of my tooth? How does laser therapy work?
Sound like you're already aware of what is going on. So you probably had some loose teeth, and then that's why they have to splint. What that means is, like, they got to glue all some of the teeth together, so that way they are not going to be loose anymore, because they probably attached some of the loose teeth to the good tooth, and now you got, like, the teeth that are not moving. But if the looseness happened because of the gum disease, which is the most likely reason, or it happened because of your severe heavy bite, and those things need to be corrected. So irrespective of whether you did the splinting, or you only connected the loose teeth, the dentist connected only the loose teeth, or they connected the loose teeth to some of the good teeth, it does not matter. That is not going to help you hold these teeth for the rest of your life, or like for longer. But if you have some existing gum disease, which existing gum disease that need to be treated. Whether the laser is a good option to treat your gum disease, absolutely. So the laser not only helps to control the gum disease, but also it helps control the bacteria. So laser will be a great option for you. I recommend you talk to your dentist. And also, and as I said earlier, and if the teeth are loose because of the bite, in addition to doing the laser treatment, which is not the only thing that is going to fix the problem, combination of the deep gum therapy and the bite adjustment along with the laser, it's all going to help.
That's right, and we do it on a daily basis.
Absolutely.
Come see us.
Absolutely. So you want to say the fancy word for filing the teeth down?
Oh, an occlusal adjustment.
Bingo, bingo.
He didn't think I knew you guys.
Yeah.
Yeah.
Occlusal adjustment. Yeah, that we call it. Yeah, the bite adjustment. Yeah.
That's right. And we typically do those with our cleanings as well.
Absolutely.
So we got you.
Yeah.
Okay. Hi, doctor. I had a deep cleaning done a week ago and was advised to massage my gums with the gel using my finger. However, I've developed a habit of touching my gums with my tongue instead because it feels easier. Is it okay to massage my gums this way, or could it affect my teeth alignment?
Massaging the last part of your question, massaging your teeth with the massaging your teeth with the finger or with the tongue, it's not going to affect the alignment. Although unless your teeth are kind of really really loose, and then when you keep massaging, then you're going to push the tooth away. And when you massage it, and if you're putting a lot of pressure, then you're going to push the teeth in. So make sure that your teeth are not loose to begin with, because you don't want to create more damage. However, the reason we say you massage your gums with the finger, because you can put a lot of good, a decent amount of pressure, right, with the finger, as opposed to if you're putting pressure just with the tongue, you're not going to be able to put as much of a pressure that you are going to require. I'm not sure to begin with why your dentist told you need to keep massaging the gum, or you are thinking that it is helping. If it is helping, great. If you massage with the finger, it's great. If it is helping just with massaging with the tongue, on the top of whatever treatment that you are already getting, any type of gum treatment, which is great. So the short answer to your question, just go for it. Yeah, absolutely.
Alrighty. And see your dentist once every 3 months.
Correct. Thank you for reminding. Yeah.
That's right. Okay. Before we come to end, we're going to try to get as many sent in questions answered as we can. But again, keep sending them in and you'll be on our next live. Hi, sir. I have a cavity between my front teeth and that I've been getting refilled repeatedly over the past 5 years. Sometimes as often as every 4 to 6 months. Is there a laser filling option available, and would it last longer than a traditional filling?
So the answer is, anytime you have a cavity, can we do a laser filling? So I don't want to say, oh, we do the filling with the laser. What we do is, as dentists, this is what we do. We drill teeth, right? Yeah, so we drill the teeth down. So what we are doing, so let me back up a second. So how do we do a filling? We drill that. Let's say you have a hole on your teeth, and we don't want to leave the hole or the cavity or the bacteria that causes the cavity inside the tooth. So what we do is we drill the tooth down to make it clean, and then we put the filling material or the composite or any other filling material on the tooth. But what do we use to drill the tooth? It is a regular metal drill is what we use. So what you're referring to is the laser filling, meaning instead of using the drill, the regular drill, we are going to use the laser to cut the tooth down. So to cut the tooth down, we use the laser, but we use the regular filling, whatever we use after the metal drill, which is either the composite or any other filling that we are going to use to fill the tooth down. However, I'm very, very concerned if we have to keep going back every 4 to 6 months. It should not happen, right? So if you're going back every 4 to 6 months, there is something serious that I can think of. Either your tooth is deteriorating very, very fast, and that's the reason why the filling is not holding strong, or you may have like a material your dentist may be thinking, unless you are switching dentist to dentist and then doing the filling, then my recommendation is you stick with the same dentist, so that way they get to know why is your body reacting this way. It is spitting the material out like every 4 to 6 months. And then sometime, like let's say you get tired of like, hey, I don't want to go to the dentist, and it could be as simple as, you may have to get like a good foundation, which is like filling the tooth, and once you have a discussion with the dentist, and they may be able to prep the complete tooth to put a crown, which may be the answer to your prayers, and that's a long-term fix. So whether that is an option for you or not, only your dentist will be able to answer that. So my recommendation is, so instead of asking them to redo the same filling, if it is the same dentist, ask them whether you need to get a crown, and crown will be like a better option, and your dentist should be able to answer whether you need the filling to be redone, or this time you want to get it one and done, and you want to fix the tooth with the crown. And depending on the type of the damage to your tooth, the dentist will be able to answer what kind of a crown you need, and then they should be able to fix it for you.
That's right. Well, this brings us to the end of our live.
And thank you all so much for watching, and we look forward to having you all next month. And until next time, thank you very much. Oh, this, right? Yeah, there we go.
See ya.
Yeah, see ya.